Hi, welcome to Table Talk. Thank you for joining us today. Today's guest is here for February's American Heart Association month, and it's Miss Tinera Conry, who is a nurse practitioner in cardiology for Ascension St. Thomas River Park. Welcome to the show, Tinera.
Thank you. Thanks for having me.
Yeah, I had never heard of a nurse that specialized in cardiovascular nursing. So talk to us about that specialty. How long have you been doing that?
So I've been a nurse for about 17, 18 years. Started off as a registered nurse. I went back to school, became a family nurse practitioner. Then I got a job as a hospitalist nurse practitioner. That's where we work in the hospital setting with acute care patients. And then kind of went from there. Then there was an opportunity for me to come back home to McMinnville, which is where I'm from, in cardiology. So,
yeah. So do you enjoy working? I would think that would be specialized, but the patients, I'm sure, are great to work with.
Oh yeah, it's something that kind of, I think we all relate to that. It carries over in all the patients I've seen through acute care. A lot of it ends up in cardiology's hands a lot of times in some way, form, or fashion.
Right. So heart health, seems to begin with blood pressure. Everybody, that seems to be the starting point that the doctor or the nurse practitioner will warn you, your blood pressure's getting a little high. So how does blood pressure affect the condition of the heart?
So of course the heart, it's a muscle, it's a pump. It pumps blood through and oxygen throughout our body. It's got a lot of vessels inside of it. So, if you have high blood pressure, that is pressure inside those vessels, that really, it strains the inside of the vessels. It can cause little tears and damage inside there. It can stretch the heart out as well. So what happens is, if you get little tears inside the vessels, plaque likes to build up, little blood clots, and plaque will build up inside that area. That can lead to a blockage or something. We hear I have a blockage. It leads to a blockage, which then limits blood flow to that area and in turn can cause a heart attack. One of the other things that can do of uncontrolled high blood pressure is, like I talked about, it stretches the heart out. It makes it kind of stiff, or it doesn't want to relax all the way when it pumps. That can lead to heart failure, which is, a weakness in the ability for it to pump correctly. Hypertension is called the silent killer. That's because a lot of times you don't have any symptoms up front. That can go for long periods of time. It also causes many other health, issues too, with kidneys, eye disease, heart.
Right. That high blood pressure, I guess checking it regularly so you can see a pattern, I guess, of hypertension.
If you don't have a diagnosis of hypertension, when you go to your doctor's office visit, that's one thing they check. If it's normal, great. Randomly, if you go to Walmart or you see the little blood pressure machine there, check it. Just kind of keep an eye on what it's doing, just to kind of know what your baseline is. If you do have high blood pressure, we recommend checking it at least twice a day, just and keeping a log. That helps us kind of know how to adjust your medicines appropriately and making sure you're where you need to be.
Well, I know it runs in my family, and I have been on blood pressure medicine for a very long time, and it's amazing how well it works. It's, ideally you probably would love to change your lifestyle and change some things like that first, but if that doesn't help, the medicine really does a whole lot of good for people.
Yeah, that's correct. And I know, nobody likes to take medicine.
Yeah.
And so sometimes we just have to, though.
Yeah, that's right. And it's just a little tiny pill, so it doesn't cause me any problems anyway. So what are some of the things, I guess, that can drive your blood pressure up?
So, of course, being here in the South and, high foods that are high in salt, anything that tastes good.
Oh, yeah, yeah.
High sodium diet, that's one of the main drivers. Being under a lot of stress, being overweight, being sedentary, not exercising, those are all things that really drive that up. Smoking or vaping is another one.
So you said vaping too.
Vaping, I threw that in there on
Okay,
purpose because I do see a lot of people say, well, I just vape, it's safer. No, not really. It's still constricting the vessels, causing issues, so it still causes damage. The American Heart Association, going back to the sodium, recommends we do specifically, less than 2 grams of salt a day. That's not a lot. If you really are looking at the nutrition labels and counting the sodium, you'd be really surprised of how high our diet is in sodium.
Yeah. I know that's a standout when you buy like those microwave meals.
Yes.
They're really high in sodium. And I can taste it also when you eat out fast food.
That's correct, yeah. And so cooking at home is always the best. You can control more of what you add to your foods. Also, soft drinks, things like that are all high in sodium. The other thing is, as far as getting exercise and stress relief, 30 minutes a day of a walk or moderate exercise if you can, just something to get moving, that'll help decrease stress and your weight.
Yeah.
Keeping a check on that.
Yeah, they've said over and over that helps keep us healthy, mind and
Yeah.
body too. So I know my big thing is I love, we'll call it Chinese food for lack of a term. You wake up the next day and you've got
Yes.
the puffiness
Your
and
ankles are
things
swelled
like that.
up
And you're
and
like,
just-
there was a lot of sodium
Yeah.
in that. But boy, it's yummy, but in moderation for
yeah.
sure. So what are some common misconceptions that people have about heart health?
So one would be, well, I don't have any symptoms, so I must be fine. That's not necessarily true. There is something called silent ischemia. That's a lack of blood flow to the heart without symptoms. Women, diabetics, they're at high risk for that. You always want to get checked out, know your family's history, things like that. So just because you don't have symptoms does not mean that you don't have disease. Another one would be, well, heart disease is only for the older people. Not true. I've seen cases, there's some people in their 20s with heart disease. Unfortunately, it can happen to anybody. One is, I work out, I'm in great physical shape. I shouldn't have to worry about that. No, I've seen people that you wouldn't believe that are in tip-top, that have the greatest physique ever, they still have heart disease. Another one is, I see a lot of people too will say, well, I don't need to exercise after I've had a heart attack. I need to take it easy. I need to sit down and rest.
Right.
The families, they want to see that too. They're concerned about their family
Right.
member. Take it easy, rest. Well, after you've had surgery for your heart, of course, there's a period of time you do need to recover. However, once you've recovered, we want you to get back into exercise and to what's tolerable to you, because that's important. If you don't, you'll end up back in the same shape you were before.
Okay.
So that's another thing. And then one other point back to, talking about not having any symptoms. A lot of people will say, I really don't have any symptoms, but then after I get to talking to them in the office, they think of chest pain, chest pain is
Right.
a heart attack. No, I've seen people tell me, I usually walk down to my mailbox every day, check the mail without any issues. But here lately, when I do that, I've just noticed I'm real short of breath, or I feel fatigued. I need to sit down and rest. Or I'm out raking the leaves and I just feel like, whew, I'm wore out. And that's different. And those are signs of heart disease as well. So it's
Okay.
not just chest pain.
Yeah,
like
right.
you see on TV. Yeah.
Right, right. Of course, we also have to be aware of the jaw pain. I've heard
Correct,
that.
yeah.
And of course, the
Arm,
arm.
jaw pain, especially in women. pain between the shoulder blades. That's another one too that I've seen.
Okay.
So,
Well,
yeah.
lots of, like you said, it can be silent, but there are cues that sometimes we have and,
Right.
and take that very seriously. Can you discuss the importance, I guess, of regular checkups and screenings for heart health?
Yeah, so I think it's, very important to establish with especially a primary care provider. That's going to build a relationship, a trusting relationship with someone first off. Prevention is key. So, going to a yearly checkup is going to make sure and catch anything early. You don't want to, the last thing you want to do is go to the doctor when you're really, really sick and the disease is already set in.
Right.
So getting in earlier helps to prevent bad outcomes. Treating those early on. Some of the things that we check for is it helps you know your risk factors too for heart disease. Going to the doctor, they check your blood pressure, see how you're doing there, your weight. They check you for diabetes. They check your blood sugar, make sure you don't have diabetes. Usually they'll do an EKG that looks for any arrhythmias. Sometimes we can see some heart abnormalities on the EKGs other than arrhythmias. We check ultrasounds of the neck, the carotid arteries for plaque buildup. They check the ultrasounds of the abdominal aorta for any aneurysms. We can listen and hear murmurs in the heart, looking at the legs for any peripheral vascular disease.
So when they're doing all of that,
There's
there's reasons
for all that. Yeah, we're kind of assessing the whole picture. We check for smoking, help people to stop smoking. Those are all
right.
things that
And
we
of
look
course, when we're young, we're, as they like to, 10 feet tall and bulletproof.
Right.
You think, I'll worry about that later, or I don't feel anything right now. But
Yeah.
as I guess you would concur that there's every reason to go ahead and get a hold of it when you are young
Yeah.
versus waiting.
And I have seen that. That's kind of a new trend. A lot of younger people are taking control of their health and,
That's
and,
great.
and doing a lot of preventive care. Another great tool that I've seen a lot of our PCPs using here lately is called the CT coronary calcium score.
Okay.
And that's a screening tool that your primary care provider can order. It's just a CT scan of the chest. It looks at the coronary arteries in the heart, and it gives you a score of how much calcium and density is maybe developing inside the heart. So say if you had one and you had an elevated score, you would probably be referred to cardiology for further testing. That also helps determine, whether or not you need to be on a cholesterol tablet to help control that a little bit better too. So
Right.
that's an awesome tool that's being used.
Okay, and you mentioned cholesterol. We were talking before we went on. My dad kind of got a little hand slap for not taking his cholesterol medicine. Cholesterol, I'm sure, is just like we talked about with the high blood pressure medicine. Your cholesterol medicine, I guess, is equally important.
It is, and there's some bad stigma with cholesterol medications, unfortunately, and some people are intolerable to them. However, there are newer options too out there for people that have difficult to control cholesterol. Maybe it's a genetic factor that doesn't matter what they do; it's just high.
Right.
There's newer injectable medications and things like that. That don't cause as much side effects to that's out there. So
Okay,
they
and
work well.
okay, good to know. So, can heart disease, is it reversible?
So to an extent, so let's going back to plaque buildup inside the arteries. So if you have plaque there, so we can't make that go away completely. So, but what we can do is try to reduce it and stabilize it. So, plaque is really rough on the edge, the top part of it. So it can chip off, break, and flow through the veins. It can go to the brain and cause a stroke. It can cause a heart attack. So, if your cholesterol levels are high, that's where the statins or the cholesterol medications come in place. So they help to smash that plaque down against the wall, smooth it out, and stabilize it.
Okay.
It kind of opens up the vessel a little bit more, allows more room for blood to flow through there. So
Okay.
that's why those are important.
That's good to know. So it can be, and I guess if you catch things early enough, and you make some changes either through medication or diet or exercise, you can kind of get ahead of it.
Slow the progression down. Kind of same thing with congestive heart failure. Once you have that, it can't be cured. However, there's medications that can help improve the pumping function of the heart and make your life better. You can still do your daily activities, and it doesn't have to just, it slows progression down.
Yeah. Well, a lot of people, I know my grandmother was diagnosed with cardiomyopathy probably 20 years ago and has the
defibrillator,
put in and stuff, and it's not really slowed her down. I mean, it's really slowed the progression. She was having some major symptoms when she was diagnosed, but it's been great how much the technology has helped keep people active.
Right. Yeah, it is. There's good medications out there that really relieve some of those symptoms that kind of limit people from shortness of breath or just not being able to do the things that they love to do. So
yeah. Well, let's go. I guess when we talked about a year ago, there was a young athlete who had some heart issues, and we seem to have that. No matter year after year, over and over, we kind of take young people's health kind of for granted, I think, but they're not immune to cardiovascular events because they tend to push their bodies too hard, or not hydrate and things like that. What are some of the warning signs maybe in young people that we really don't pay attention to?
Yeah, so, especially in, like we're talking about in the athletes, sudden cardiac death fortunately is not very common in that group, but it does happen. And so, your coach or parent can watch out for signs of chest pain, especially with exertion, like they're getting out there working hard and they're having chest pain, shortness of breath, swelling in the legs, heart racing, palpitations, or just feeling like your heart's kind of not beating right.
Right.
Fainting is a big one, anything like that. Dizziness, fainting, those are all major signs to look out for.
Okay. And I would guess that one would need to be kind of aware of that, especially after a hard practice, maybe out in the sun and things like that.
Yeah. And I know our sports, our teams here, they do sports physicals, and they also do EKGs prior to the students playing. I know my kids, when they were on the sports teams here, they all had that. So that helps to look at any
That's good to know because they're kind of checking on things ahead of time.
That's right. I think it's become a bigger deal. People are more aware of this happening and trying to prevent that and looking for, knowing your family history too is a big deal. Because one of the main causes of the sudden cardiac death is a genetic disorder called hypertrophic cardiomyopathy, and that's just where the walls of the heart are too thick, and so they can't pump as well. Also, it can cause some fatal arrhythmias, which cause them to fall out, so.
Okay, that's good to know, and I guess there's, kids start participating in sports younger and younger, but it's never too soon, I guess, to have an awareness of that. Yeah. So what are some of the resources that we have locally at River Park? I know Ascension also, runs Highlands and DeKalb and Stones River too, but what are some of those resources that we have here?
So here we've got, of course, Inpatient Services, or we have an office here. There's myself and 12 other cardiologists. They all range in different subspecialties of cardiology. If you're inpatient, they're able to contact us. We can come see you in the hospital. We have cardiology testing here. We can do echoes, which are ultrasounds of the heart, stress testing. We have a new fabulous mechanism to check for blockages. It's called a CCTA. It's similar to the coronary calcium score I've talked about, but it's they give you the IV contrast, and we can see a little bit more detail of if you do have blockages, how large they actually are. So a lot more detail. It's a fabulous test to use. So that's kind of what we offer here. And then in the surrounding counties, such as DeKalb, Sparta, Woodbury. Same thing. We have outreach clinics where the cardiologists go there, and they do provide cardiology testing as well, some of the basics. We also have a fabulous cardiac rehab service here and at DeKalb too.
Okay.
So after surgery or anything, you need cardiac rehab, they offer that too.
It's nice not to have to always go to Nashville for those things, and that the doctors that are at St. Thomas in Nashville are coming here to see patients. So.
It is. It's so hard for a lot of people to go out of town. So.
Well, as traffic and things like that, I hear a lot of complaints, about having to go out of town to the doctor. So that's a great resource. Yeah. Well, thank you so much, Tinera. You have been a wealth of information, and we do want to remind our audience that today and this month, all month long, is Heart Month. Think Valentine's. Think of your heart, of course. Yeah. Good time to check in with your doctor and check your blood pressure, and if you're not doing that regularly, get that going and kind of keep it monitored. But thank you so much.
Thank you for having
great
me.
resources. And I'll say thank you to our audience for joining us again this week. We hope you will come back again for more Table Talk.